The rotator cuff is a crucial part of the shoulder that allows us to move our arms and perform everyday activities. It's made up of 4 muscles and their associated tendons that surround the shoulder joint, keeping the head of the upper arm bone humerus securely within the shallow socket of the shoulder. These musculus supraspinatus, infraspinatus, teres minor, and subscapularis work together to stabilize the shoulder and enable a wide range of motion. A rotator cuff tear occurs when one or more of these tendons are damaged, either partially or completely. This type of injury can result from acute trauma, like falling on an outstretched arm, or from gradual wear and tear due to repetitive movements over time. It's a common condition, especially among people over 40 athletes, and those whose jobs involve frequent overhead activities. There are 2 primary types of rotator cuff tears: partial and full thickness. A partial tear means that the tendon is frayed or damaged but not completely severed. In contrast, a full-thickness tear, also known as a complete tear, means the tendon is entirely detached from the bone. In some cases, the tear can extend across the entire width of the tendon. The symptoms of a rotator cuff tear can vary, depending on the severity of the injury. Many people experience persistent shoulder pain, especially when lifting or lowering the arm. There might be a noticeable weakness in the shoulder, making it difficult to perform tasks like combing hair, reaching behind the back, or lifting objects. In some cases, there's a crackling sensation or clicking sound when moving the shoulder. Pain often worsens at night, particularly when lying on the affected side, disrupting sleep and overall comfort. Rotator cuff tears can occur for several reasons. Acute tears usually happen due to a sudden injury, like falling or lifting something too heavy with a jerking motion. Chronic tears, on the other hand, develop gradually due to repetitive stress and age-related degeneration. As we age, the blood supply to the rotator cuff tendons diminishes, making it harder for the body to repair small damages. This gradual degeneration increases the risk of a tear, even with everyday activities. Certain factors can increase the likelihood of developing a rotator cuff tear. Aging is one of the most significant risk factors, as tendons naturally weaken over time. People over 40 are more susceptible, but younger individuals can also experience tears, especially if they engage in activities that involve repetitive overhead movements. Athletes, such as baseball players, swimmers, and tennis players, are particularly prone to rotator cuff injuries due to the repetitive stress placed on their shoulders. Similarly, jobs that require frequent overhead work, such as painting or construction, can also lead to tendon damage over time. Diagnosing a rotator cuff tear typically involves a combination of a physical examination, medical history, and imaging tests. During the physical exam, a healthcare provider will assess shoulder strength, range of motion, and areas of tenderness. They may ask the patient to perform specific movements, like lifting the arm to the side or reaching behind the back, to identify signs of weakness or pain. Imaging tests are often used to confirm the diagnosis and determine the extent of the tear. X-rays can reveal bone abnormalities, such as bone spurs, which can contribute to tendon damage. However, X-rays alone cannot show soft tissues like tendons. An ultrasound can provide real-time images of the shoulder, allowing the doctor to see the tear and assess its severity. Magnetic resonance imaging (MRI) is the most detailed imaging method, offering clear views of the soft tissues. including the size and location of the tear, as well as the condition of the surrounding muscles and tendons. Treatment for a rotator cuff tear depends on the size and severity of the tear, the patient's age, activity level, and overall health. Non-surgical treatments are often the first line of approach, especially for partial tears or less severe cases. These treatments aim to reduce pain, improve shoulder function, and prevent further damage. Rest is crucial in the early stages of treatment. Avoiding activities that exacerbate the pain can give the tendon time to heal. Applying ice packs to the shoulder for 15 to 20 minutes several times a day can help reduce inflammation and pain. Non-steroidal anti-inflammatory drugs and NSAIDs, such as ibuprofen or naproxen, can also relieve pain and swelling. Physical therapy plays a vital role in the recovery process. A physical therapist will design a customized exercise program to strengthen the shoulder muscles, improve flexibility, and restore range of motion. Strengthening the muscles around the shoulder joint can help compensate for the damaged tendon and improve overall shoulder stability. Exercises often start with gentle stretching and gradually progress to resistance training as the shoulder gains strength. If non-surgical treatments don't provide sufficient relief, or if the tear is severe, surgery may be recommended. Several surgical options are available, depending on the size and location of the tear. Arthroscopic surgery is the most common approach, involving small incisions, through which a tiny camera, arthroscope, and specialized surgical instruments are inserted. This minimally invasive technique allows the surgeon to visualize and repair the torn tendon with less damage to surrounding tissues. In some cases, open surgery may be necessary, particularly for large or complex tears. This approach involves a larger incision to access the shoulder and repair the tendon. Another option is a mini-open repair, which combines arthroscopy and a smaller open incision to achieve optimal results. For massive tears that cannot be repaired, tendon transfer surgery or even shoulder replacement may be considered. Recovery after rotator cuff surgery varies, depending on the extent of the repair and the patient's overall health. In general, the rehabilitation process can take several months, requiring dedication to physical therapy and gradual strengthening exercises. The shoulder is typically immobilized in a sling for the first few weeks to protect the repair. As healing progresses, the focus shifts to regaining range of motion, building strength, and eventually returning to normal activities. Preventing rotator cuff tears involves maintaining shoulder strength, flexibility, and overall joint health. Regular exercise, including shoulder stretches and strengthening exercises, can keep the rotator cuff muscles strong and resilient. It's also important to practice proper posture and body mechanics, especially when lifting objects or performing repetitive overhead tasks. Taking breaks during activities that strain the shoulders can reduce the risk of overuse injuries. For those already experiencing mild shoulder pain or stiffness, early intervention can prevent further damage. Consulting a healthcare provider for an accurate diagnosis and appropriate treatment plan can make a significant difference in long-term shoulder health. While rotator cuff tears can be challenging, proper care, rehabilitation, and preventive measures can help individuals regain strength, function, and quality of life. In addition to understanding the causes, symptoms, diagnosis, and treatment options, it is essential to recognize the emotional and psychological impact of a rotator cuff tear. Chronic shoulder pain and limited mobility can affect daily life, making simple tasks challenging and leading to frustration and even depression. Patients may find it difficult to sleep, work, or participate in recreational activities, impacting their overall well-being. Support from family, friends, and healthcare providers can make a significant difference during the recovery process. Encouragement, patience, and understanding can help patients stay motivated and committed to their treatment plans. Joining support groups or talking to others who have experienced similar injuries can also provide valuable insights and emotional support. Ultimately, the key to managing a rotator cuff tear lies in early detection, appropriate treatment, and ongoing self-care. By staying informed, proactive, and engaged in their recovery journey, individuals can overcome the challenges of a rotator cuff tear and enjoy a healthy, active lifestyle once again. Whether through conservative management or surgical intervention, the goal is to restore shoulder function, alleviate pain, and improve overall quality of life.